guys. I'm Patsy Cunningham. You all have seen me on season 2 as well as some episodes in season 3. I am a licensed clinical professional counselor. I received my bachelor's in psychology and my master's in mental health counseling at Bowie State University. And I think I spoke a little bit about just some of my clinical training and what target population I typically work with. I have been in the behavioral health field for over 14 years, and I've been a clinician for about 9 years working with children, adolescents, as well as adults. The target population that I traditionally work with are individuals who have co-occurring disorders, meaning they have a substance use and a mental health disorder. I just really enjoy what I do. My primary focus now is really on clinical training and bringing awareness to mental health to various communities and, really expressing the importance of addressing your mental health issues.
Okay, so I wanted to go and just break down a couple of episodes on this season. We saw you on episode 1 and 2 for our He Should Still Be Here episode.
Yes.
And that was talking about substance abuse disorders and kind of the signs.
Right.
So just professionally, I know people might come to you hopefully as a first resort, and that's what we're trying to get our viewers to do.
Right.
It's to seek therapy instead of self-medication. So if you could just talk a little bit about those first 2 episodes.
Sure. So the first 2 episodes, I think for viewers that are watching it, you may have, had a little bit of concern, oh, well, am I self-medicating? Am I using my prescription medication? Because there was a little bit of information about how psychiatrists also prescribe medications that can be very addictive. And so what I would say is, if you are taking medication that is not prescribed to you, I know people all the time that take ibuprofen 800 because they're having bad cramps, but it was prescribed to their daddy for their toothache. You should not be doing that. Although you think that is nothing wrong with it because it may not be a narcotic, you still should take medication based on the way that it is prescribed. And you also should, even if it is prescribed to you, medication benzodiazepines that typically, people can be prescribed for mental health, reasons, or if you're taking medication for pain, you had a surgery, you should only take it based on the way that your doctor prescribed it to you. So if you, had a surgery and you were taking codeine or, some other type of narcotics, you should not be taking that because now you have another pain that's not associated with the rationale as to why it was prescribed to you. So oftentimes taking medication in a way that is not prescribed can lead to different addictive behaviors. And even if you think that, you're taking it as you were told, or you're not taking as much, you need to be very careful about even taking a half of a pill, because sometimes the therapeutic effect that when you break a pill up, that's not intended to break. It can make it a little bit more toxic. So you just have to be very cautious on the way that you take medication. Also, the way that if you feel like you're not able to function without the medication, that is a symbol or a sign that there may be some dependency that's being built. And so, sometimes people will say, well, I still have the pain, and it may not necessarily be the same pain that it was originally prescribed for. So I just highly recommend whenever you're taking medication, especially medication that is a narcotic, you are very cautious and very careful. And if you feel like you can go without taking a medication, not saying you just got a massive surgery and I'm saying just take Tylenol. That's not what I'm saying. I'm saying you just have to be very careful, especially if you are in recovery. You need to be very clear and very honest with your doctors. Sometimes when you have oral surgery, they prescribe you narcotics. Sometimes if you have, broken bone or injuries, you just have to be very honest and transparent with your doctors as well as your psychiatrist, because they may prescribe some medications that's a narcotic as well. Be very honest and open about what your history is. It's nothing to be ashamed of. People used to make it seem like substance use was a moral disorder, but we do understand understand it is a psychiatric disorder, and that people who are suffering from, heart disease, you should be looking at substance use the same way you look at someone that has diabetes. It's something that they are medically struggling with, and that they are hopefully seeing a professional to address, provide some type of therapeutic intervention, and just, go from there. So I think that, if you're watching this episode, and if you were watching the episodes throughout the season, just understand that you have to look for different signs. If you can't function, if you feel like you're irritable without it, or if you feel like your day is not right unless you're taking a drink, your day is not right unless you are medicating yourself in some way, and this gonna hurt some feelings. But even in regards to marijuana, that it really changed your perception, it changed the way that you function. You're not necessarily supposed to be driving a vehicle while you're under the influence of alcohol or marijuana, and just because something is legal don't mean that it's good for your body, and don't mean that it can't be addictive. So
right. Another thing that we touched on in that episode is families and their perspective of watching a loved one struggle with substance abuse. Do you think that they should seek therapy as well?
So when I, work with patients, typically I do identify, when I do the biopsychosocial, so that's the initial assessment when a person comes into my office, I ask them questions about, their support system, because you can't do it on your own, especially patients who, tend to struggle and have struggled for several years. The majority of the patients that I worked with, they had been doing substances for over 30 years. And so you're human, and so you're going to be involved with a loved one. You may have a girlfriend, you may have a mom, a dad, or whomever that you're connected to. And so oftentimes you have to have some type of accountability. So a patient could come into my office every session and tell me that they're doing good, telling me that they're not relapsing, and if we're not catching it during a drug test, the random UAs, then, which is a urine analysis, sometimes you have no choice but to, just look for some of the physical symptoms. Oftentimes I can see, I've been a clinician for quite some time and working with patients with substance use for a long time. So, oftentimes there's some manipulative behavior that comes with it. So I look for different behaviors. I look for, if their skin is looking a little bit more grayish than usual, if their patterns of behavior is changing, are they constantly late for their appointments? Are they missing their, probation officer appointments? Did they follow through with the, referrals that I did for employment? So just certain things, although it could just be everyday things, I try to make sure I'm looking at those things. And so when you have a family member involved in their treatment protocol, then you can get a little bit more of the behind the scenes type of perspective. When you come into an office of a doctor, typically people are afraid to even tell them, that my head has been hurting for the past 3 months, because they feel like, oh, well, they're going to judge me, or they're going to wonder, why I didn't come in sooner. So even the same thing when you go into your therapist's office, you're not always going to be as transparent as you should be, but I really encourage people, if you're seeking therapy, you might as well be honest, so you can't fully be assisted unless you're being totally honest. And this is a safe place in order for you to be able to work out some of the things that you're going through. So if you are not honest, you're honestly not helping yourself, you're only hurting yourself. And so when families are involved, you get a broader perspective, but I also have an opportunity to edify the family. Sometimes families are just like, well, I don't understand why you can't just stop. I don't understand why he keeps doing it. He's saying that he loved me, but he's breaking my heart. You have to really understand that this is not something that you just pick up and put down and you're just going on about your merry day. As well as children, I've seen parents who really are struggling and saying that they're trying to reconnect with their child, but there's so much anger built up for the years that they've already lost. And sometimes it's like a roller coaster. You are doing good this day, but then they maybe Christmas comes around, they remember that, okay, this is when my mom or my dad first started using, and this is when they remember that they didn't get gifts, or that the parents may have stolen some of the gifts or sold some of the gifts because of their addiction. And so it just depends. So I think that it's really vital for your family members to be involved in your treatment planning. So allocating at least one session for a month for the person to be involved. Even when working with children, I typically ask the parent, can they dedicate at least 1 week to come and do like a family session? Even if the therapist is not emergent family therapist, is they still have training in, working with the identified patient, which would be the person who either have the substance use disorder or the mental health disorder, and helping provide some psychosocial education to the family on some of the behaviors or some of the symptoms or some of the traits that the person may exhibit, and letting them know that some of these behaviors are normal for someone who's suffering from bipolar, or these are some things to look out for if the person may be, facing a relapse. So the ways that you can identify, or even if a person have depression, and just helping them identify what are some signs that the person may be relapsing in regards to their depression, or they may have some suicidal ideation. So I always encourage, no matter how old the patient is, or no matter who the identified patient is, that family members be active in their treatment for themselves as well as for the patient.
So we talked to Vernon and Marcus. They're both current addicts.
Correct.
And they just explained how hard it is to just stop on a daily basis. They both alluded to the idea of some days they just want to end it all. So can we speak to them, and also anybody watching that's struggling with substances, and also thinking about starting it to just cope with the pain that they're dealing with? Right. How they can heal and how therapy can help them benefit their situation.
Okay. So, to Marcus and to Vernon and to anybody out there that is currently active in their addiction, we understand that in order to make any type of change, is different stages. You have contemplation, and you just have all of these different phases that you're at. And sometimes you feel like you're ready, and then sometimes you second guess, you start to talk yourself out of it. Honestly, if you are considering therapy, if you're considering treatment, that is honestly the first step. And I did realize that it was family members that was also on those episodes who just really wanted to push them and wanted to know, why haven't you done it? If you say that you want this therapy, or if you say, and even the sister who expressed that, sometimes she can't even sleep at night, or just how it breaks her heart to not even hear from her brother and not knowing what's going on with it, going on with him. And so this is relevant to anyone out there who is concerned about a loved one that's active in their addiction. The person who is active in their addiction has to make the decision first. It is nothing that anybody can do that's going to get them to really stay committed to treatment. And it's not that they don't want it, it's just hard. Sometimes, the physical withdrawal symptoms overtake them, even if they made up in their mind that they want it. And so that's why I really think that, a person who has a substance use disorder need to be connected to many resources, not only NA and AA meetings, but also, just resources at home. People who are not going to make excuses for their behaviors, people who are not going to give them money to go and get the substances and things like that. Just really holding that person accountable, but also being cognizant that this is a struggle. It's not something that you just wake up and say, yeah, I'm good today, and oftentimes my patients tell me that is on their mind all day long. And it's not that it's something that they want to do, but it's something that they feel like they have to do in order to be well. Just imagine just going through physical withdrawals, cramping, just feeling like your body is just tearing itself apart. That is typically how it feels when someone is going through a physical withdrawal. And so when you think about it, you think like, well, how can you just walk around? You think about like a menstrual cramp, right? And how sometimes it's excruciating pain. Just imagine just your whole body just feeling like it's like cramping and aching and just all of those different symptoms. I think that, when someone decides that they're ready, it has to be so many different things in place. So the treatment facility has to be the right facility. You have to make sure that you connect them. And just being totally honest with you, my mother had a substance use disorder, and I was able to get her into treatment one time, and when it was the time, it was just the time. I didn't take anything like, she was like, oh, well, I don't have my ID. You don't need your ID. We're going, so just certain things that are going to be contributors, or, things as to why they won't go in. You have to push them, but don't push them too hard, because you don't want them to then feel like they don't have like an ally in you. And just in regards to the treatment facilities, really do your research, and if you're trying to help your family member get into treatment, look at the information on the website. Do they have a 7-day detox or a 3-day detox where they're going to be able to really address those physical symptoms? Because the first couple of days in treatment should be focused on getting that person well. Right? You should not enroll a person into long-term care and not provide any type of medical attention to them if they've been active in their addiction and they're using, an opioid, because that can be very deadly, honestly. So just looking at what resources the treatment facility also have, as well as the wraparound services once they come out. And not everybody that have a substance use disorder have a mental health disorder, but if they do, oftentimes people that are self-medicating, once they get clean, those depressive thoughts come back, that anxiety come back. So you should make sure that that's why I talked about providing services to someone that have co-occurring disorders. You should make sure that those services are being provided at the same time. You wouldn't treat someone that has high blood pressure and diabetes separately. You would be addressing both of those medical conditions at the same time. So you should be doing the same thing about someone's mental health. If someone is struggling with, opioid addiction and they also have depression, you should be treating both of those disorders simultaneously.
Okay. So the next episode, we talked to some young Black kings, and we talked a little bit about just the day-to-day trauma of not only being a teenager or child with COVID and missing school, but also being specifically a Black teenager with social media right in your hand, and you can see these police brutality, different things that's happening. I know one of the boys did express that he is depressed because of just the lack of the social piece is missing. So how can we identify that our child is depressed? Because they're not going to come and tell us 9 times out of 10.
Right. So there's different criteria that a person has to meet in order to be diagnosed with depression. And so typically what I say for children is looking for signs of, that's not within their normalcy. Now, mind you, as a teenager, like most of the young men that has been on the interviews, they're going to be just going through different emotions because it's different things that's chemically happening in their body while they're going through puberty and why they're, trying to identify who they are. So I don't want to scare anyone and just, everything I say, be like, oh my God, my child has depression, because that's not the case. So what I would say is looking for, if they're isolating, looking at if they are, not interested in things that they used to enjoy doing. Has their appetite decreased, but they typically have a normal appetite? Are they sleeping a lot? Are they distancing themselves? I know that some activities can't be engaged in because we are, still supposed to be social distancing. So if they were typically, playing basketball 2 years ago every single day, but they're not doing it now, that's a little bit normal because they're not supposed to be, in close proximity to a lot of other people. But if they, typically are on their phone, but you see they don't even charge their phone, or they're not engaged in social media anymore, and is not, because of something that you told them not to do, but a lot of just, change in their behavior, or if they're constantly complaining about stomach aches or headaches, sometimes our mental health symptoms can manifest within our physical. And so, oftentimes, like when people have anxiety, they complain about it feels like I'm having a heart attack, or their heart is constantly racing, or they're having chest pains. Or if someone, is anxious about something, they also can have, feel like they're nauseated, or, feel like their stomach is upset, or even like a lot of headaches from depression, or, just feeling like they're not feeling good, but there's no other medical reason as to why they feel that way. And that's not only true for children, it's also true for adults. Sometimes the mental manifests within a physical. So I would just say look for change in pattern behaviors. And honestly, we can do some preventative measures. We don't have to wait till our child is exhibiting these particular behaviors. As best as you can, make sure that your child, whether they're 5 or whether they're 15, have a sense of normalcy the best that you can. Try to have some type of consistency, or some type of, some type of pattern that they're following that they used to follow, because when you try to be as consistent as possible, then the child will feel like they, have some control over what's going on. And when, anybody, if they feel like they have no control over their life, you start to get anxious, you start to get sad. If everything that is just happening to you versus you allowing it to happen, it creates a lot of stress, especially just in people in general. And, in children, when they're learning themselves, they're typically talking back to their parents like, why I gotta do this, why I gotta do that. So just imagine every single thing have shifted. You're not, engaging with your peers. So that's that social emotional growth that's supposed to be taking place, but it's not. You're looking at a screen all day long. You can't really concentrate. Our attention span to be able to sit in 80-minute classes, all day, like that's not really healthy. You're supposed to get up, you're supposed to take a break, but you're not really able to do that when you're on virtual learning, or when you're, even with this hybrid model where children are going back into the schools, they're not really able to engage with one another. So just imagine, you're essentially feeling like you're a captive, in captivity to not being able to talk, not being able to just having a mask over your face, and even the anxiety that it creates with thinking that you will get COVID. It's so many people who have lost loved ones from COVID. People are very anxious about, am I washing my hands enough? Did I, if I have a cough, I went back to school. So, did I bring something to my house? Did I give something to my parents? Can I go see my grandparents? Because now or somebody that has a underlying health issue, can I even see them because I decided that I wanted to go back to school? Even finding out that somebody is sick that you've been around, and if you've been around other people, sometimes it creates a sense of guilt and shame. And even when people are diagnosed with certain infectious disease, we understand that they have that guilt around, what did I do to deserve this? Did I do something wrong? So even thinking about COVID, although we know that it's a international virus, that it has really impacted several continents, people still feel ashamed, and people still feel, sometimes embarrassed about having COVID, or, coming in contact with someone who has COVID, because you think about, were you partying? Was you not being safe? Were you not being clean? So I think that we have to really just focus our children on trying to have some type of consistency, edifying them on, how to prevent the spread of COVID, as well as how it's not a dirty word. People that have COVID is not someone who is vexed with some spirit and they did something totally wrong and they're, cursed or anything like that. So just helping bring in awareness and education as to what it is, how to protect yourself, how to protect your family members. And if you have any opportunities to do any type of social kind of like groups, maybe do like a Zoom and have them engage with their friends and talking and things like that. So I know we also heard from some young ladies in regards to the traumatic experiences that they faced, whether it be sexual or physical abuse, and just, how it wasn't really, they didn't feel protected. Oftentimes as young Black girls, we are made to feel like we are responsible for the things that happen to us versus feeling like we're protected. And so although, this has been going on for before my grandmother probably was born, I think that it's something that I'm really glad that you're bringing awareness to, because it's not, no matter what a little girl has on, no matter what a little girl does, they're still a child, and it's still the responsibility of their parents and the adults around them to protect them. I do not agree that just because, it happened years ago, that it should not be reported. You're not around that person anymore. That doesn't matter. There's no statute of limitations of child abuse. When a patient come into my office, I tell them, that everything that we talk about is confidential unless they disclose something about child abuse, or they disclose something about them wanting to hurt themselves or hurt someone else, because you never know, that person could currently be doing that same thing to another child. And although even if the person, honestly, it's crazy, because even if the person is deceased, I still have to report it. As a mandated reporter, even the person is deceased, I still have to report it, because it may help to solidify somebody else's case that was brought against against them. And, sometimes people feel ashamed to, like I said, there is a lot of shame associated with being a victim. And it's crazy because oftentimes, even with people who are victims of intimate partner violence, when they tell their doctors or they tell other people, they sometimes are victimized. Like, well, what did you do? And so the same thing with the traumatic experience as it relates to being sexually abused, raped, of any kind, sexual molestation, or whatever the nature of it is. Oftentimes people are trying to figure out, what did you do wrong? Although the victim is already trying to figure out, was it something that they did that brought this about? It is nothing that you did that brought this about. We don't understand why people do those type of behaviors or exhibit those type of behaviors. And I'm not going to sit up here and say, oh, well, sometimes when people are, people always say, oh, well, he has a mental health disorder or they have this. That's not an excuse. There's so many people who have mental health disorders that don't go and molest people or rape people. So we're not going to make excuses for the abuser. We are going to, in the future, do better in making sure that we report these things, making sure that we talk to our children, girl or boy, about, appropriate touch. I think that is always a good opportunity when we're raising our children to let them know about good touch, bad touch. Also, as they continue to grow, as they continue to develop, as they continue to be out of our presence, and just making sure that we make them aware of what is appropriate, what's not appropriate, and making sure that if something happens to them, no matter whether the person say, oh, I'm going to hurt your parents, I'm going to do this, I'm going to do that, making sure that you tell, because if you don't tell, then you won't be able to get the help. And when a child is physically or sexually abused, I think it's very important for them to seek therapy so the therapist can help them walk through that particular incident. Because like I said, when you're thinking that it's your fault, when you're thinking that you did something to deserve it, sometimes you may start to have depressive emotions. And not saying that you're going to now have a depression disorder, but it's going to be things that's going to be associated with that.
There's different forms of anxiety that show up in everybody, not teens in general, but I know teens, even test-taking anxiety. I know when I was in middle school, for like the whole 6th grade, I would have like butterflies in my stomach. And even now as an adult, I still struggle with anxiety. But I didn't know it back then. I would have got help sooner. And just dealing with death, grief, anything that you need healing from, or just generally you just feel like you need somebody to talk to. Can you just tell us the benefits of talk therapy versus like journaling or speaking to a friend, and what to expect when they get there? A lot of people are nervous to go because they think, I'm gonna have to lay on the sofa and talk about my life, and I don't know, they just have anxiety about going to therapy. Like, how is it like?
Okay, so for anyone who is interested in therapy or somebody that tried therapy and they felt like it didn't work, it's a relationship, right? So in order for therapy to be effective, you have to build a healthy relationship with another person. And when we have had incidents where our relationships have not been healthy, it's very scary. You don't know if you can trust the person. You think that they're, more like your friend or more like your parent, where, if I say something that they don't like, they're going to judge me. That's totally not what therapy is supposed to be. I'm not saying that if that has been your experience that you're not, your experience is not valid, but if that has been your experience, then you need to fire that therapist, because that's not what it's supposed to be. Therapy is supposed to be an opportunity for you to have a safe haven, for you to talk to someone who is professionally trained and equipped to deal with your emotions. So you should be able to go into the office and hand it over to them, and they are going to dissect it, right? You go into an office and you hand your illness over to your medical doctor, and they're going to say, okay, based on scientific research, it looks like you have a cold. It looks like you are experiencing some type of toxic shock syndrome because you did this, you did that. Your therapist is supposed to say, okay, so based on what you told me, it looks like you're experiencing a little bit of depression. Let me show you what I mean by this. So they're supposed to be walking you through the process. They're supposed to be explaining to you. So they're educating you, because the purpose of a therapist is for them to equip you with the skills, so then you can go on and live your life by implementing those same skills, and you can be well. You should not go into a therapist's office and they tell you everything to do, and you're just, going to constantly have to go into that office, and everything that happens in your life, they tell you how to respond to it. No, they're going to give you the tools so you can utilize those tools to then make healthy decisions of how to move on consistently throughout your life. You're not supposed to be building a unhealthy relationship with this provider. They're supposed to be helping you to live your own life. They're not supposed to be saying, yes, get that divorce. Yes, take that job. Yes, do this. They're supposed to help you understand your emotions, unpack some things that you may have, suppressed deep down inside, help you understand why some of the behaviors that you're exhibiting possibly exist. They're not magicians. They're not, psychics where they say, yes, okay, this is what it is. That's not how it works. So if you are having this expectation, I want to paint a more of a realistic picture of you, for you, of what you're supposed to be doing. You're supposed to be doing the work. You're supposed to understand yourself a little bit better. You're supposed to understand people better when you're leaving out that office. You're supposed to utilize whatever clinical skills that they helped you with, cognitive, therapy, or whatever type of interactions that they've had with you better. You're supposed to be healing, but I do want to tell you, it's going to be hard when you go at first, because you're unpacking, you're helping them understand who you are in order for them to help you move past those things that have happened to you, whether traumatic, whether hurtful, whatever the case may be. In order for you to get over emotions of sadness that's related to a divorce, you're going to have to talk about that divorce. So it's going to bring up hurtful feelings or hurtful experiences or things that you've gone through in order for them to help you process it and then get into healthier relationships. So the difference between seeking professional advice and talking to your homegirl or talking to your homeboy is this person is going to create a safe space for you to grow. Oftentimes when you're talking to your friends or your family members, they are thinking from a point of view where they, want you to just do better, and they're not understanding the reasons why you're making decisions that you're making. The therapist is supposed to understand the reasons why based on the information that you give them, which is why I said if you're not honest with them, you're not doing anybody a disservice except for yourself. Journaling is a part and a form of a therapeutic process. I typically have my clients do cognitive homework where, when they're not in the office, they're able to track some of their emotions. They're able to identify some things that are going on. They're able to process it when they're not with me. I don't want my clients to have to call me every single day that they're not in the office, because I'm not helping them grow. Right? So in order for someone to grow, they have to continuously identify what these issues that are plaguing them and see how they can implement the strategies in order to get better. So therapy comes in different forms. Also group therapy. If you're interested in just doing group therapy at first, there's nothing wrong with that. You have an option. You have opportunities to do whatever makes you feel comfortable. You can do that as well. And the universality of group therapy helps individuals feel a little bit more comfortable about their individual sessions, because they understand it's not just me. Sometimes people think like, well, I have all these good things going on in my life. Why am I still sad? Why am I still depressed? I'm not, financially struggling anymore. I thought I was depressed because I didn't have enough money to pay the bills, and now I have enough money to pay the bills and I'm still sad. You may be clinically depressed, and you thought it was just based on your circumstances, but it's not, and so being able to talk to someone who can help you walk through that process will be beneficial to you. And sometimes people may need medication. It may be a chemical imbalance that is creating, those particular emotions in you. And so you have the opportunity and the right to say, I want to try medication. So I think that, understanding the difference between what it's like to see a therapist and what it's like just to journal, what it's like just to do meditation or yoga or jog or whatever kind of like puts your mind at ease, I think that all of those things can be a part of the therapeutic process. But if you are not getting relief, or if you are seeing that you're missing work, you're seeing that you don't, want to engage in activities that you typically like to engage in, you can't leave out the door because you're so anxious, your heart's always racing, your hands always sweating, your head's always hurting, your stomach's always hurting, you can't, go into a crowd without feeling like you want to vomit, or you always think that somebody's talking about you, you're nervous, you're anxious, all of those things. I truly think that it would be a benefit to see a professional therapist, whether social worker, psychologist, professional counselor, or, whatever it is, even recovery coaches are, an extension of the therapeutic process and the treatment team. So it's too many people out here who are professionally trained, either through licensing license or through certification for individuals to feel like they had no options. It's too many options available. So I highly recommend it.
You did touch on this a little bit, but the people that I've talked to, like adults that I interviewed for letters, some of them will say, oh, I did seek therapy, but I don't think it was for me. Like, I didn't like my therapist. Can you just talk to people about finding the right clinician and just having patience with the process? They think that you're supposed to talk a couple times. It ain't work. I'm still depressed. I'm not healed.
Right.
Just
okay. So I am about to hurt some feelings, but it could be you. It could be you. If every single person, let's say you say, well, try another therapist. They're like, well, I tried 15. Well, what was going on when you were trying those 15 therapists in your life? Were you receptive to therapy? Were you willing? Were you upset because they challenged you? Were you upset because you felt like they, didn't agree with everything that you said, or they didn't take your side? A therapist is not a person that's supposed to come in here and just make you feel good. Like I said, the reason why there's a difference between a professionally trained clinician and your family members is because they're going to help you walk through the process, and they're going to show you and paint the picture of what's actually going on based on what you are telling them. If you're not completely honest, then they can't completely help you. And if you think that they're going to agree with everything that you're saying, then you're sadly mistaken, especially if you're making unhealthy choices, or you're, addressing your life situations with maladaptive behaviors. You're telling your therapist, well, this is what works for me, and they're telling you that that's unhealthy. You can't be mad at the therapist, but it is situations where therapists are just not a good fit, and I'm not saying that you have to have a black therapist because you're black, or you have to have a woman therapist because you're a woman. That is not necessarily true. You have to have the person that is a good fit for you. So just like when you're dating somebody, you have to try, it's trial and error, and what I highly recommend first is researching the person. The same way that you're gonna, now I know a lot of people are looking at Yelp, a lot of people are trying to look at reviews before they go to stores, see if they're black owned, see if they have any grievances against them because of things that they did that were inappropriate, disgruntled, things like that. Clinicians, just like a grocery store, just like a crab shack, they have opportunities for people to, grieve if they did something wrong. So even checking out that person's history, looking at what their background is, you don't want to, if I want to go to therapy because I, am dealing with, stress related to my job and I'm an adult, I don't want to go to a person that's only trained to work with children. Not saying they can't assist me, but they may not be the best fit for me, right? So I think that when we're looking for a therapist, the same way we're looking for other things, do research, look at their training, interview them. The same way that they interview you, you typically have an opportunity to do a consultation, a free consultation at that, with this individual, and you ask them, okay, even with myself and looking for someone, because I feel like, children can benefit from therapy, saying what I want for my child, okay, I want a fully licensed clinician, or I want a person that, is experienced when doing play therapy. I want a person that's experienced with dealing with grief and loss and things like that. You have an opportunity to interview that person. So make sure you're interviewing them, make sure you're receptive to therapy, and try it out. And if it doesn't work, don't wait until, 17 sessions down the line to be like, therapy ain't for me. It may not just have been a good fit. It may not have been a good time because you may not have been receptive. You may have, been going about it because somebody told you to do it and you really didn't want to do it. So it's so many different factors of why things don't work out. Even with doctors, I didn't fire doctors before. Like, you take too long to come to the back to see me, and when I'm telling you something is going on with me, you don't take me serious, and you say, oh no, you're okay, there's nothing wrong with you. No, I want someone who's going to consider what's going on with me. I want them to take me seriously. I want them to believe what I say. And if you're talking to your therapist and the only thing they're saying is you're making this up in your mind, you're like, no, that probably is not the therapist for you. So it's different factors that come into play when things don't work out. Sometimes it is us. Sometimes it could be the other person. So try something else out. Even let's say you want to get your roof done. Oftentimes you go by word of mouth, somebody who recommended a person. So ask someone who has been effective in therapy, do you recommend the person that you're seeing for me? or even not even for you. Do you recommend a person? Are they on time? Are they consistent? Do they listen to you? Do they talk more than in a session than you talk? And let me tell you, in the beginning of the session, the therapist may talk more than you're talking because they're interviewing, they're getting information, they're getting to know you. If they don't, then it's not going to be, effective. I remember my clients just wanting to come in and just fall all the way apart in the beginning session. But no, I need some documentation on you, especially because many times people are using health insurance. So I have to document what I have done. I have to document this information in order for me to come up with a valid diagnosis, right? I can't just make something up because you want services. So in order to come up with a valid diagnosis, so when I have a audit from the administrative service organization, then they will be able to reimburse me for the services that I'm providing for you. So when your therapist is asking you 1,000,001 questions, that's the reason why. They have to figure out what is going on with this person and how can I help them. And then they're going to constantly check in with you. And so sometimes you may go into therapy and be like, well, I didn't want to talk about that today. But if you have a treatment plan, right, and you say your presenting problem was you're depressed, and you were mainly depressed because you had just ended a relationship with your child's mother, I'm going to ask you about that when you come in, because we're supposed to be getting to an end goal. And so at the 6-month mark, I'm supposed to be assessing where we're at. And so sometimes you may not feel like talking about stuff, but it is the responsibility of the therapist to figure out, are you progressing? Are you not? And although the presenting problem may have been what brought you to therapy, it may be some underlying issues of what's really going on. And so you have to be honest with your therapist, and then they can continuously reassess what's going on with you and see what is the best way forward. So I guess the final takeaway for the teen viewers who are watching this, because you've seen people talk about their experience of not addressing things, or even, their experience of dealing with trauma, dealing with substance use, dealing with depression, and dealing with so many different mental health factors, I hope that you understand that not only is it important for you to focus on your academia, not only is it important for you to focus on what you want to do when you grow up, it's also important for you to be in tune with your mental health. It's very vital for you to acknowledge things that are going on with you, not to suppress them. If you're not prepared to talk to a therapist, talk to an adult. Talk to your mother, talk to your father, tell them about the things that you're experiencing. And if they don't seem to be able to connect with you, talk to a school counselor, talk to your teacher, talk to someone that you feel is responsible and it is safe for you to express your emotions. You have to make sure that you are addressing things head on versus hiding them and feeling ashamed of them. I would tell my daughter and any other preteen, teen, young adult, it is nothing in this world more for you to be embarrassed about, whether it was something that you did or something that somebody else did to you. It is nothing for you to be embarrassed about. It is always someone who has gone through something that you've gone through, or who are going through something that you're going through. So you're not alone. You have to address these things head on, because if you don't address them head on, they're going to continuously follow you. So I think that if you want to live a happy, healthy life, and you want to heal from things that have happened to you, it is vital for you to address them and for you to connect with someone that you trust. Therapy is a safe place for you to be able to grow, for you to be able to address things, for you not to have to tell everything to your parent, and for you to be able to feel like you can really just unload. Sometimes you just want somebody to talk to. You may not even have depression. You may not even have anxiety. You may just be going through something right now. You're a teenager. You're growing. You're evolving. You don't know who you are yet. You probably still feel like you got to people please, because when you are younger, your parents are typically, applauding you. Oh, yay, you went party. Oh, yeah, you did this. You got good grades. And they're not doing that as much. right? So when you're a preteen, nobody's coming up to you like, oh, you brush your teeth. Oh my God, you put deodorant on. So you feel like, hold up, what's going on? Like, you're not as engaged with me. You're making me more responsible for things that I thought that I was doing that you should be happy about. So I think that when you are watching this and you're watching all of the different episodes and you're trying to connect with yourself, you're trying to see who you are, consider your mental health. Like I said, I'm Patsy Cunningham, and I am transitioning to providing more clinical training as well as just more self-help type of, services. So I do have a podcast called Behind the Heart, and you can find that on all platforms where podcasts are played, as well as my Instagram page, which is Dedicated Hearts LLC. You can also look on my website to see the services that I offer at dedicatedhearts.com.